Welcome back. Well, we want to continue our conversation with Dr. Manala Makua. She's the Chief Director of Women's Health at the National Department of Health. And today is International Day of Action for Women's Health today. And there's a lot of issues that we can discuss. And the doctor was talking to us about the importance of prioritizing sexual and reproductive health for women. The doctor is still with us. Doctor, thank you very much indeed for sticking around, because this is indeed an important topic to discuss. I want to throw the spotlight, as we've been saying, with regards to providing quality sexual and reproductive health care for women. I mean, talk to us about this new National Integrated Sexual and Reproductive Health and rights policies, and how far does it go? And does it go far enough in the right direction in terms of rights-driven approach?
Yes, thank you very much. The Sexual and Reproductive Health and Rights Policy, it's got its own related guidelines, and the key thing about the policy is to make sure that the package of service is comprehensive enough. What we try to do is we do not want women to be attending the services in an integrated manner. I'll give you an example. You do not have to come today for a cervical cancer screening and come the following day for your contraceptives and come the other day for the request on either termination of pregnancy, or come that other day for the planning of your pregnancy. We have packaged it in a way that it's comprehensive. It covers almost all the components, all the 13 components that are involved in the sexual and reproductive health. That's one thing. But the other thing, the policy itself, it covers it responds to the health system challenges, which leads to the stigmatization of women who require some services. I'll give you an example. Women who would require service on termination of pregnancy, for an example, oftentimes they are being stigmatized, and mainly because people view that as one thing that is not essential. So the way it's been packaged currently is to say the service on termination of pregnancy is as essential as women who are coming to report their pregnancy or to attend their antenatal care. So we put them all in the same level so that we don't have one service that is more important than the other.
Look, this policy sounds great on paper, but for it to work effectively, I guess guidance needs to be provided, for the healthcare facilities. How are you making sure that this happens at a pace that won't compromise healthcare?
Like you've indicated that the policy is new, the policy was approved in 2019. What we've dedicated the time for 2020 is to make sure that we put up the systems that will respond to the needs and the way the policy has been packaged. For an example, the way we train our healthcare providers is now in an integrated manner also. The way we arrange the services, you have one stream. You go to a clinic, we have a stream that says maternal, child, and newborn care service, meaning it's a full package. So you don't have a situation where you're going to say, this is a TOP clinic, this is an antenatal clinic, or this is a delivery clinic. We all package them. So we're training the healthcare providers, and we're also working very closely with advocates on sexual and reproductive health to make sure that they educate our women out there on their rights, on what is essential for them and what is it that they can achieve, or what is it that they can get as a package of service when they visit our facility.
Doctor, disability and reproductive health, challenges and victories in trying to solve some of these issues. Are we as a country making any headway in this regard?
I must admit that there's still a challenge in that field. You can imagine that disability is broad. I think we've made some strides in some of the disabilities, mainly the physical disabilities, but we still have to engage further with other organizations that deals with other forms of disabilities in order to make sure that no one is left behind.
All right. Thank you very much indeed, Doctor, for your time and your perspective. Be well. All right, that was Dr. Manala Makua, the Chief Director of Women's Health at the National Department of Health. We're going to take